Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barwa. Our top focus story today is the declining COVID numbers in India. Now, India has reported less than 1 lakh daily new cases after 63 days. 86,498 new cases have been reported in the last 24 hours, which is the lowest in 66 days. There have been 2,123 deaths that have been reported. Active cases in India have decreased by 97,900 in the last 24 hours. Active cases currently in the country are down to around 13 lakhs. Now, recoveries continue to outnumber the number of new daily cases that we're seeing for 26 consecutive days. The recovery rate in the country has increased to 94.29%. Now, the daily positivity rate in the country is currently below 5%. It's currently at 4.62%. And the positivity rate in India has been less than 10% now for 15 consecutive days. All of this is good news. Vaccinations in the last 24 hours have also picked up pace. Over 33 lakh individuals have been vaccinated in the country in 24 hours. But as our states begin to unlock, there are experts who warn that the worst might not be over. We absolutely cannot let our guard down because India could see another wave before the end of the year. To make sense of these predictions, Professor Girdhar Babu, the head life course epidemiology PHFI Bangalore, joins us. Thanks so much, Dr. Babu, for being with us. I want to begin by asking you, you've written and researched extensively on COVID-19 waves and the fact that the worst might not be over. I want to begin by asking you, can we officially say now that the second wave in the country is over given these declining numbers?
Yeah, thanks Rishika for having me on this show. I wouldn't say the second wave is over in all the places. I would definitely probably agree that the second wave is mostly over in all the metros and urban areas. Whereas in the rural areas, the cases are still surging, and because we do not have as robust as testing facilities in the rural areas compared to the urban areas, we are not getting the clear picture in terms of what is the burden of cases in the rural areas. However, we are in the declining phase of the second wave, and probably towards 20th of June and beyond, we should be seeing officially the end of the second wave.
All right. So you're saying that only around the 20th of June can we actually say that the second wave is on a declining trend. It's interesting that you say that as far as rural cases are concerned, we're still in a bit of a dark spot. We don't really know the true extent of the spread of the virus. But Dr. Babu, you've written about the third wave and your predictions of a third wave before the end of 2021. Tell us more about that.
Rishika, in case of any infectious disease, as the threshold of susceptibles builds up, once the critical number of people are built up over a period of time, we are bound to have outbreaks. And these outbreaks can be larger or smaller depending on what is the number of people who are susceptibles. Who are susceptibles? Those who are not vaccinated and those who are not infected. Given that the latest sero survey has shown only 1 in 4 are probably infected, and our vaccination coverage is still not more than 4% for 2 doses, we cannot say that we have a reasonable proportion of population who are completely protected against another infection before the end of December. So by looking at the kind of pattern of how this accumulation occurs, it is expected based on few mathematical model results that by the end of October or the beginning of November, there will be initial clusters developing, and towards the end of November, we might see an upsurge in cases. So this is based on, again, the mathematical predictions, assuming that the vaccination rate is same and at least half of the people would follow non-pharmaceutical interventions. One of the brilliant paper by Rajesh and Shiva in Indian Institute of Science, Bangalore, they show that even when the non-pharmaceutical interventions followed nearly 66%, at the current vaccination pace, we will definitely have the next wave in the state of Karnataka. They've even published the paper.
Right. It's interesting. You're saying that a third wave of COVID could potentially hit India end October, could perhaps peak towards the end of November, December. These predictions, you're also interestingly saying, are based on the fact that the vaccination coverage remains the same. But that's obviously not going to be the case. One is hoping and assuming that a large section of our population is vaccinated by that time. Do you believe, therefore, that a wave might still come, but we may be able to control the intensity or the number of people who get a severe disease and require hospital admissions?
Yeah, I'm very optimistic that such a possibility does exist. To quantify, in the United States, from the third to fourth wave, there is reduction in more than 70% of cases during the peak of the case surge.
Right.
And this was possible only because nearly 30% of the population were vaccinated. But if we look at our own pace as of now, Rishika, only not even 25% of the 60 years and above are vaccinated as of today, which means that even in the age groups that we started much earlier, we have not been able to make a dent in terms of covering more than 50% within that age group. So we should definitely plan for vaccination at an unprecedented pace, so a pace which is probably not seen anywhere in the world, to ensure that more than twice the billion doses are covered by the end of December.
Are you worried about the efficacy of the vaccine against the Delta variant and future emerging variants?
I am not particularly concerned about the Delta variant as of now, because if you examine the way the second wave has occurred in India, it has been rapid upsurge and rapid decline. So Delta had a significant adverse impact so far. What I'm really concerned is not allowing for further development of newer variants of concern. As we are all aware, if there is high circulation of the virus going on, the virus gets more opportunity to replicate. Right. The more it replicates, the higher is the chances of newer variants. So to do that, the only two ways ahead is, one is fast vaccination, both in terms of speed and also coverage. Second is aggressive containment, to identify the clusters as early as possible so that we prevent it spreading from others. At the same time, we need to step up genomic sequencing of the clusters so that we can potentially avert any large outbreaks.
All right. Well, thanks so much, Dr. Babu, for joining us with clarity on that. And I think as India's cases continue to dip and as different cities enter various phases of unlock, it's important to remember that the threat of the virus is very much there. There is still a rapidly spreading variant here in India. And like Professor Babu said, we must absolutely go out and get ourselves vaccinated, because that's the only way that we can actually control the number of severe cases as and when a third wave of COVID hits India, which according to his predictions would be before the end of this year. Now, when we talk about a third wave of COVID, one of the biggest fears is that it may hit children harder, because they are the section of our population currently for whom we don't have a vaccine. Now, stories of large number of kids being infected in Maharashtra, 10,000 children testing positive in Ahmednagar in Maharashtra, the Delhi government announcing pediatric task force dedicated to kids if a third wave hits, all of this has parents worried. Now, there have also been reports of a healthy 18-year-old who suffered a heart failure post-COVID. This has also raised many questions. This 18-year-old thankfully is well and recovering now. But experts say that parents needn't worry. They say that data from the second wave says that while children are equally prone to getting COVID, there is no evidence to suggest that they will get a more severe disease or will be more severely impacted. In an allied development, clinical trials now for Covaxin for use in children have begun. The vaccine is being tried on over 500 healthy volunteers between the age group of 2 to 18. So these are all very interesting developments that have taken place. Let's go across to Dr. Chandrakant Laharia, epidemiologist and health system specialist, who's written extensively about what will happen to children if a third wave hits. We also have Dr. Ashwini Mehta, senior consultant cardiologist from the Gangaram Hospital, joining us. He is in fact the doctor who treated the 18-year-old healthy kid who had heart failure as a part of, his post-COVID complications. I want to come to you, Dr. Chandrakant Laharia, first, because I think the big cause of concern among parents at the moment? Are all of these news stories about children predicted to be harder hit, questions about, whether we need dedicated pediatric task force, ICUs for children? What's your assessment? Do you think there is enough evidence to suggest that children will be harder hit, God forbid there is another wave of coronavirus?
So there is no scientific or epidemiological evidence that children would be harder hit in any subsequent wave, be it third or fourth wave. Let's look at some numbers. We know that out of every 100 people, the proportion of children or proportion of population which is 0 to 18 years is around 37 to 40 people. So in every 100, there are 37 to 40 people who are younger than 18 years. But look at the numbers of people, a proportion of those in this age group who are admitted in moderate or develop moderate to severe illness out of 100 people. And that proportion is only of every 100 patient who were admitted with the moderate to severe condition, only 8 were younger than 18 years. So what it conveys, while there are 37 to 40 in every 100 population who are younger than 18, but only 8 are admitted out of every 100 people admitted in hospital. So proportion of sick children who contribute to overall number of children is really small. Now that's one part. What happens in adult who are around 60% out of 60 in every 100 who are adult? Around 92 are of the sick people are adults. So adults have a disproportionately higher number of admission than the children. That's one. Second part is that we have not seen any change in the proportion of children out of total population who is getting admitted increase. So there is no reason to believe that this would subsequently increase. I also want to bring third dimension that we have seen in the United States, which is doing a really high number of vaccination, and the vaccination coverage has reached around 50% for the both shots, and another 40% has received one shot. So there is a discourse in India which says that as the vaccination will increase, children will be at higher risk. But there is no reason to believe. Data from United States say that children do not become proportionately higher as part of the total number of sick people as the vaccination coverage increase. And finally, I would say that one of the key things to remember is that whatever we are hearing as part of that, in Ahmednagar, 9,000 children developed infection. But yeah, children do get infected. But we know that in Ahmednagar district, 86,000 of the total people in that month got admitted.
Right.
So 9,000 was 11% only, which is far less than the total proportion. And the number of deaths was only 2. So children do get infected, but the moderate to severe illness is very, very rare in children.
All right, I think that's a very important clarification, because you're absolutely right. The Ahmednagar story of close to 10,000 children being infected did send panic waves among a lot of parents. But what Dr. Lahiriya is clarifying here, and it's important to understand the context of that story, is that at the same time there were 86,000 people in that area who had got COVID, out of which 9,000 were children and only 2 children died. So the point that you're trying to make here is that there's no evidence to suggest from the second wave that children will be harder hit. I want to ask you a quick follow-up question before I bring in Dr. Ashwini into the conversation. Dr. Lahiriya, there is also a theory which suggests, and questions have been asked on whether the Delta variant of COVID has the potential to cause more severe disease and therefore potentially cause more severe infection in children. Is that fact or myth?
So recent preprint study which has come out and which has been done by the National CSIR ICGB group. What they have done between the November 2020 to April 2021, they have looked at the genomic sequencing, and they found that by April 2021, the Delta variant has become the most predominant variant in city of Delhi. Now, they also found 2-3 other things, that this Delta variant is 50% more transmissible than Alpha variant. Now, we know the Alpha variant was already 50% more transmissible than ancestral variant. So this is definitely higher transmissibility. It also has shown some sign of breakthrough infection or immune escape, but Indian study or Delhi study has not found that it caused severe illness. But we are hearing from United Kingdom that some of the probability there that Delta variant could lead in severe illness. But what we need to remember, that even if that variant caused severe illness, it will be across the age spectrum. It is unlikely to affect children disproportionately.
Okay.
Because,
Right. I think the other important story, and I'd like to bring in Dr. Ashwani Mehta here as well. He's a senior consultant cardiologist at the Gangaram Hospital. He treated recently an 18-year-old healthy child who suffered heart failure. Dr. Mehta, was this a one-off? Do people, even younger people, need to be very careful? Can you tell us a little more about this case?
Yeah, in fact, this is a complication post-COVID infection. And as we know that the COVID virus infects various parts of the body, it affects predominantly the lungs, but it also affects the heart. Many people would develop a post-COVID inflammation of the heart, leading to the muscles of the heart getting inflamed, causing myocarditis. And once the myocarditis occurs, it can cause heart failure. Now, something very interesting, when this boy came to us, he did not have any features suggestive of fever or anything. He just came with heart failure. And he was in a life-threatening situation and required to be admitted. And he also had multiple ventricular arrhythmias, which are life-threatening. And he had to be given BC shock and various treatment modalities. But subsequently, this boy recovered. So this could be one of the cases of COVID infection presenting at myocarditis, which is really unusual. And when we did his COVID antibodies, they were strongly positive, and the family had history of COVID infection. His other siblings and parents did have COVID infection just about 10 days prior to that. And he had a very high level of antibodies, suggesting that he did suffer a COVID infection recently, leading to the damage to the heart.
Right, but he was healthy with no previous heart condition?
No, absolutely healthy, and he was a very good player. He used to play football, and he was doing very well. Right. There were no symptoms at all, and this developed gradually post one bout of fever, which just lasted a day, and after a week he started to feel very weak,
right,
and his day-to-day activities were difficult to do.
All right. Well, I think, and you of course treated him and he's well now, so that's also an important clarification that we'd like to give our viewers. Yeah. And you're also saying that this is the rarest of rare case, but it has happened, and therefore I think it's important that everybody monitors their own symptoms and reports any anomalies at all to a healthcare professional, especially if you're recovering from COVID. Thank you so much, Dr. Mehta, for joining us, and congratulations to you on your timely intervention and saving the life of this 18-year-old boy. We're going to slip into a very short break. Dr. Chandrakant Lahiriya will continue to be live with us on the other side as we answer your questions on the COVID vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions you may have about the vaccine. We all take to Google to frequently ask these questions. We have with us Dr. Chandrakant Lahiriya, epidemiologist and health system specialist, to answer some of those questions. Dr. Lahiriya, one of the most commonly asked questions is about COVID-19 symptoms. What do you need to be aware about in terms of COVID symptoms, and have symptoms over a period of time changed or evolved, or do they largely remain the same?
Rishika, I could not hear the question clearly. Can you please repeat?
Yes, I said COVID-19 symptoms. What are the most common symptoms, and have they changed over the last 1.5 years, or do they continue to remain the same?
See, the most common symptom in COVID-19 is fever and like lethargy, restlessness. So those are the symptoms. But lately there have been a wide variety of symptoms which have been identified. And some of those symptoms include the loss of taste and smell, which is so very characteristic and specific to the COVID-19 condition that it is considered equivalent to RT-PCR tests, that somebody developing loss of taste and smell, it is considered very equal to getting COVID-19. A person can reliably go for tests. Other symptoms are including diarrhea, respiratory difficulties, and other aspects are developed. But most of the people will come with a cough and fever and the respiratory difficulties. So, but one should be aware that if he or she has come in the contact with an individual who has recently been diagnosed with COVID-19, then no matter which type of symptom the person had developed, that person should isolate himself and also go for COVID-19 testing.
Right. And Dr. Lahria, as we move on, are we learning more about new symptoms of COVID, or have they always been around? Are they characteristic of the new variant? Do we know more about this?
So the variants are mainly related to the how quickly the virus can transmit, or immune escape, which means that somebody who is previously infected and develop antibody, but the new variant can have a risk of even reinfecting the person, or also breakthrough infection, which essentially means the person might be protected from the traditional or ancestral variant, but may not be affected by the new, can still be affected by the new variant. So these are the three factors which results in determination of a variant of concern. But it is not really linked. All the variants cause more or less similar symptoms, so we really don't know if there's one particular symptom which is specific to a particular variant. So it's not variant linked.
Right. I think when we talk about variants now, the other big question that a lot of people are asking is if the COVID-19 vaccine is effective against the new variant.
So there are a number of studies which are emerging now. One of the study which was done in laboratory, which has found that against the Delta variant, which was originally called B1.617.2 and was first reported from India, the efficacy of first shot of Covishield vaccine, Oxford AstraZeneca vaccine, is relatively lower than the efficacy against the previous earlier variants. However, the two-shot efficacy of this vaccine is very similar. More recently, on 4th of June, Lancet published another laboratory analysis where they looked at the neutralizing antibody and their effect against the Pfizer-BioNTech vaccine, and they found the Pfizer-BioNTech vaccine is 5 times less effective in neutralizing antibody against the traditional variants. So we are finding these laboratory information, but it is difficult to predict that what will be the efficacy in the real life, effectiveness in real life situation. Just to remember the point that these variants, for example, UK study analyzed the efficacy of single dose against the mild cases, while in India we are focusing upon moderate to severe illness and effectiveness against that. So these studies are not exactly comparable, but they provide important indication that there is a likelihood of less effectiveness of some of the newer variants against, or the less effectiveness of the vaccines against these newer variants.
But many say that it will still grant you the protection that you need against severe disease.
Precisely, because these studies or these vaccines have been studied against the traditional variants and the moderate to severe illness. However, I would be a little cautious in saying that it will be same effectiveness, but there is no reason to believe that the effectiveness would be very different than the ancestral or traditional variant.
Well, that's an important clarification there. Thanks so much, Dr. Lahria, for sparing your time and being with us on NDTV.
Thank you very much.